Dr. Angrist, would you please introduce yourself to the jury?
Sure. My name is Alfred Angrist. I'm a doctor in Chicago. I've been licensed as a practicing doctor in Illinois since 1976.
Okay, so can you tell us a little bit about your background as far as where you went to school? Where did you go to college?
Sure. Went to the University of Wisconsin in Madison for my bachelor's.
Okay.
And then after that I went to the University of Chicago, their medical school there.
Okay, and what about after medical school? Did you have any ongoing graduate level education?
Yes, I had my internship in pathology for a year at Northwestern.
Okay.
And then after that, I spent 2 years in residency at the University of Chicago.
Okay, and so you've been in Chicago since what was it, 77 or 78?
Yeah, since around that time, 76. So
Okay.
probably more than 30 years now, I think.
And a lot of doctors will write different articles on different subjects. Have you had any articles published?
Absolutely.
How many?
Actually, over 200.
Over 200 articles. Okay.
Yes, sir.
And what about are you a member of any professional professional groups or societies?
Yes. Obviously, the American Medical Association. Also, was a president of the Cook County Medical Society for a
Okay.
year. Vice president of the Medical Society of the state of Illinois, also for a year. President of the Illinois Pathological Society for 2 years. Also, I'm a member of the Chicago Council for Social Welfare, and also the Health Insurance Plan of Illinois.
Okay. And what areas are you qualified in?
Morbid anatomy, which is sometimes also called I think it's anatomical pathology.
Okay.
Also clinical pathology and forensic pathology.
Okay. Forensic pathology. What is forensic pathology?
That deals with the diagnosis of the causes of injury or death, especially in the legal context.
Okay. So that is to say, you would be qualified in determining or diagnosing the cause of death or other injury.
Yes, someone gets stabbed, someone gets shot. We find a body lying somewhere.
Sure.
How did they die?
Sure.
That's the idea.
Okay, great. Well, let's go back to the night of December 7th, 1996, when Mr. Ramirez sustained his injuries. I'd like to see if you could, help us diagnose what happened on that night. And so, have you had the opportunity to review the medical records or talk with Mr. Ramirez about what happened?
Absolutely. I met with him at my office.
Okay.
Examined him there. Had him take off his shirt. Looked at the wound, or rather the scar by that time. Asked him a couple questions.
Okay.
Also reviewed all of the medical records from the time he was admitted to the hospital to when he was discharged
Okay.
several weeks later.
Wonderful. And could you just sort of summarize what you found in those medical records, and then through the medical records?
Sure. Would it be okay if I showed you on a piece of paper?
Yeah,
or something
sure.
like that?
Got it right here. Here you go. You can step up here.
Okay. Well, the bullet wound was in his right scapula, so that would
Okay.
be approximately here.
Okay.
So I'm just going to put a box here.
Okay.
And the medical records show that the bullet was lodged in the heart right here. And
Okay.
they took it out with surgery
Okay.
and then sewed him back up.
Okay. Anything particular that you noticed when you examined Mr. Ramirez?
Yeah, in fact, the edges of the bullet wound, instead of being round like that,
Sure.
it looked sort of irregular. It was sort of, the edges were a little ragged, and it wasn't quite circular shaped.
Okay. Okay. So in your opinion, what was happening when that occurred? In your opinion, after reviewing those records and so forth.
I think the most likely explanation is that he was getting up from the ground when he was shot from above.
Okay. And why? What would be well, let me ask you. So that would be consistent. Let me give you a quick hypothetical. So let's say that Mr. Ramirez was on the ground, and he had been fighting, and then he began to get up off the ground, and he was shot by someone standing. Would that be consistent with and the bullet entered his shoulder and so forth as he was getting up? Is that consistent with
Yes.
Is what you're saying? Okay.
Absolutely.
And what would be your reasoning? Can you kind of give us your rationale behind your conclusion?
Yes. The first reason is the shape of the bullet wound.
Okay.
As we've discussed, it wasn't nice and circular. The edges were ragged, which
Okay.
indicates that he was moving at the time he was shot.
Okay.
And if he's getting up off the ground, that would be perfectly consistent with the ragged
I
edges
see.
of the bullet. Also, the sharp downward path of the bullet, in order to get from the
Right.
right scapula all the way down to the heart. Can I show you?
Yeah.
If he was just shot from straight behind, you would sort of expect that the bullet would end up somewhere around here,
Somewhere
maybe
in
even go
the same
further.
area, right?
But because of this path of the bullet, that would be perfectly consistent with someone shooting him from above as he was standing up.
Okay. Let me just ask you one more hypothetical before we let you go. And let's say that instead of being down on the ground, Mr. Ramirez was standing up straight, and he was shot by a police officer standing, directly behind him. Would that be consistent with the data that you reviewed and your examination and the reports?
No, that wouldn't be consistent.
And why not?
Because I would expect to see a circular hole
Round hole.
in that case, and it wasn't a round hole.
Okay. Thank you for your time. No further questions, Your Honor.